Hi, I'm Dr. Russell Radican. I'm the clinical director here at Wellness One Memphis, and we see a lot of patients with chronic knee pain. So much so, I thought I would make a short video to address two of the most common questions that we have in our office. Number one is, why do I have chronic knee pain? And number two, are there non-surgical treatment options for chronic knee pain? But before I do so, I want to discuss a little bit about some statistics of chronic knee pain. It might surprise you to know that approximately 100 million Americans suffer with chronic knee pain every single day. And also that chronic knee pain represents for 25% of all primary care doctor office visits are for chronic knee pain. As a result, 50% of all NSAIDs are prescribed for chronic knee pain. Now, an NSAID is non-steroidal anti-inflammatory drug. An example of that prescription would be Mobic, meloxicam. Over the counter would be Aleve, Advil, ibuprofen. That is very commonly used. Now, chances are, if you're watching this video, either you or someone you know or love has chronic knee pain. So it's very important to understand that it's prevalent. It's not you, it's prevalent. There's a reason for this. And the reason why, I'm going to use a model of a right knee. The knee itself is the largest joint in the human body. It's a weight-bearing joint, and that means that we're on it all the time. And that's one of the reasons why chronic knee pain is so prevalent, because when we injure it, we never truly give it time to heal. Now, an overview of what the knee is made up of. This is the thigh bone, also known as the femur. This is the shin bone, also known as the tibia. This little shy, bashful bone back here is the fibula. Now, there is a tendon that runs from the thigh down to the shin, and it starts here called the quadriceps. It runs over the kneecap or the patella, and underneath is the patella tendon. So if I flip this over, that is your patella. That is your kneecap, okay? And it sits in the tendon between the femur and the tibia. Now, since I have it open, I'm going to talk about the three compartments of the knee joint itself. There's the lateral joint. I'm going to move this over just a bit. That's the lateral joint. This is the middle joint, and this is the medial joint. Now, I'm going to focus my time and my attention right now on the medial joint. The medial joint happens to be where 90% of all chronic knee pain is. And the reason why is just by the way we walk and the things that we do, the physical activities, put a lot more pressure on the inside of the knee. And so over time, this cartilage begins to break down. And incidentally, that's what this represents. This is the cartilage, is like a cushion or somewhat of a shock absorber between the thigh bone and the shin bone. And over time, this is where the breakdown actually takes place. And when the destruction is severe enough, that starts sending the pain signals, and it could be swelling initially, and then eventually it becomes somewhat of a bone-on-bone type pain. Now, by the time these patients have come to our office, for the most part, they've already tried things such as steroid injections. There's a type of gel shots, and there's many different brands and many different names. These gels form like a pseudo or a fake cartilage, and it's temporary, but it does give some patients relief temporarily. Another type of treatment that some patients have had is known as orthoscopic surgery. It's where a surgeon goes in with a specialized camera scalpel, and they go inside and they remove tiny particles of cartilage that may have broken away and may actually be the cause of some of the knee pain. Now, by the time these patients actually make it to our office, they've, for the most part, have been informed that they need to have or need to consider having a joint replacement surgery. So when the patients come to our office, they want to know if there's a non-surgical treatment for chronic knee pain, and that's what we do. That's called regenerative medicine. Regenerative medicine is the process of healing and repairing the cells and the tissues within. And when this happens, it restores normal function or normal movement within the body. And the whole idea and the concept is we inject in two different places within the knee itself with the regenerative medicine. It's a combination of different things that we use in our office depending upon what the patient needs. And what happens is over time, this substance is taken in by the body, and the body recognizes as special repair cells, and they begin repairing and healing the knee. One of the first things that patients comment on is the decrease in pain or inflammation almost overnight. And that's a process of the body healing and repairing itself naturally. Now, I don't want people to to think that regenerative medicine is an overnight procedure. This is a procedure that takes time. It may take weeks to months before you actually truly get the full benefit of the treatment that we provide. So if you or any of your family members are interested in a non-surgical treatment option for chronic knee pain, I urge you to contact Wellness One Memphis. Again, I'm Dr. Russell Radican. Thank you.